This is today's daily NCLEX snack. A nurse working on a neurology step-down unit is caring for a client with a history of seizures. Which nursing actions apply to the care of a client who is having a seizure? Select all that apply. Now, a quick tip for select all that apply questions is to treat each option as true or false. Then you can move on to the next one. Don't start to blend all the options together because this will confuse you. Let's look at our options. Number 1 says, note the duration of the seizure. True or false? This is true. The nurse should stay with the client to reduce the risk for injury and observe and time the seizure. Number 2 says, restrain the client. True or false? False. You should never restrain a client during a seizure. This could cause serious injury to the patient. Number 3 says stay with the client. True or false? This is true. You never want to leave a seizing client. The nurse should stay with the client to reduce the risk for injury and to observe and time the seizure, like said before. Number 4 says insert an oral airway. True or false? Now, don't let this one confuse you because we do want to maintain a patent airway, but you should never place something in the client's mouth during a seizure. So this would be false. Number 5 says loosen clothing around the client's neck. True or false? This would be true. Loosening the clothing around the client's neck ensures a patent airway. Number 6 says place the client in a lateral side-lying position. True or false? This is true. You want to place the client in a lateral side-lying position to decrease the risk for aspiration because saliva can drain out of the side of the mouth and not into the lungs. Okay, let's look at the do's and don'ts of seizure precautions you need to know for the NCLEX. The do's, like I said before, you should always note the time and duration of the seizure. You always want to maintain a patent airway. You can loosen tight clothing so it's not restrictive around the client's neck. You want to place the bed in lowest position to prevent injury. You want to provide privacy as much as possible. Move sharp edges and furniture away and put padded side rails up. And remember, you want to turn the patient to side-lying position to decrease aspiration risk and cushion the head with a pillow. Okay, now for the don'ts. You never want to do these things when a patient is having a seizure. You never want to force the jaw open. You never want to place anything in their mouth. You never want to leave the patient unattended. And you never want to move the patient unless they're in imminent danger. That's all for your daily NCLEX snack. If you want more NCLEX-style practice questions, you can sign up for the daily NCLEX snack. This is where you get an email every morning with an NCLEX-style practice question and a comprehensive review. And it's free. The link to sign up is in my bio. Happy studying, future nurses.